Let's go ahead and get started. So today's talk is on heart health, kind of fitting given it's February and American Heart Month. So what we're going to talk about today is natural approaches to preventing heart disease. My goal today is to inform you guys on what it is that we're trying to prevent in terms of progression of heart disease. And I know there's so much focus on cholesterol. I kind of want to give you a different perspective on cholesterol and what other areas to look at when we talk about preventing heart disease. So that's where I want to get at today, and also give you some lifestyle tools that you can apply yourself with regards to prevention and management and treatment of heart disease. So with that, I'm Dr. Lena Kian. I'm a naturopathic doctor. And just a little bit on background on what naturopathic doctors do and what naturopathic medicine is. We are a distinct part of the healthcare system that blends thousands of years of traditional wisdom with current scientific advances. So it's kind of the best of both worlds. And it covers anywhere from perinatal to geriatric care. And the credentialing is naturopathic doctors, or NDs. And you might hear terms like holistic medicine, complementary and alternative, integrative medicine, homeopathy. There's so many interchangeable names, but with regards to the credentialing, it's naturopathic doctor, which is the primary care credentialing, the same level as you would see with a medical doctor and osteopathic doctor. So basically, what it is we're recognized as PCPs attending a 4-year postgraduate medical school, and in addition to the standard medical curriculum, we also have training in natural therapeutics. So the goal that I have every time I give these talks is that I want you guys to apply the naturopathic therapeutics that a naturopathic doctor would apply in their practice with yourselves. All the time, my goal is to get people to realize that healing is within them and they should be their own best doctor. So that's kind of why these talks are helpful. You can kind of apply it to your own life. So NDs are recognized by the Naturopathic Medicine Department of Consumer Affairs, and in addition to diagnosis and treatment, we use primarily naturopathic therapeutics in prevention and treatment aspect. So these are the 6 principles that we follow every time there's something that needs balancing or anytime a patient needs care. The very first being the healing power of nature. And I think we all know that when we get a cut, and we don't even, unless it's a really bad cut, in which case you want to go to the ER. But a lot of times your body has the wisdom to heal itself. So whatever therapies we utilize, we want to tap into our body's inherent healing ability. The second one is identify and treat the cause. And unfortunately, sometimes we just focus on the symptom, not realizing that there's a deeper root cause that may be going on. And if we treat that, the symptom goes away. So we always want to go beyond, treating the symptoms. And then the third one being first, do no harm. And that's always a big one because, a good example is that we're not against drugs and surgery. There may be a time where that might be more protective. So for example, if someone has high blood pressure, we don't want to say, well, don't take drugs, they're bad for you, and here they are with uncontrolled blood pressure, because there are risks with that, right? We don't want to increase the risk of strokes or having kidney disease. We want to make sure we're responsible. So first, do no harm is, can we find the safest therapy that also protects you from possible risks? So that's another philosophy. Number 4 is treating the whole person, recognizing the mind, body, and spirit is one. So we always want to approach the whole person. Number 5 is the reason I'm standing here talking, is the word doctor in Latin, which is docere, means to teach. So we always want to educate people to be their own best doctors and really tune within. And then lastly, prevention is the best cure. So rather than just waiting till the problem comes, we want to be proactive and prevent. And then these are some of the areas that we look at. And today I'll focus a lot on lifestyle. I think there's a lot we can do with lifestyle medicine when it comes to heart disease prevention, but you can see, anything from nutritional counseling, especially hypoallergenic diet. I think there's a lot of focus now on food sensitivity, so we look into that quite a bit. Medical nutrition, using vitamins and minerals as therapy. Botanical medicine, there's so much wisdom with herbal medicine that we can utilize. Homeopathy, which is one of my personal passions. It's such a deep deep therapy. Hydrotherapy using water as therapy, physical medicine, therapeutic exercise, psychological counseling, lifestyle. I'm going to focus a lot on this today. And then some focus on minor surgery and use of appropriate pharmaceuticals. So that example would have been, if someone has uncontrolled blood pressure, we want to make sure we use blood pressure medications if necessary to make sure it's controlled until we get to the underlying causes of what may be. And I'm going to go over blood pressure today. So just kind of a little bit more pyramid as well. You can see it's kind of like your food pyramid. We always want to look at lifestyle, removing what may be in your body's way of healing itself. So that's kind of what we call the therapeutic order, reestablishing the foundation of our health, the way we eat, the way we sleep, the way we talk, the way we move, just the things we do on a daily basis. And then stimulating the healing power of nature. And that could be things like acupuncture, homeopathy, clinical nutrition, things that really help the whole person heal. And then we might go a little bit more specific to the third component, which is treating the weakened system. So today I'm going to talk about certain nutrients that are good for the cardiovascular system. So that's a little bit more specific. Or another talk could be certain nutrients that are good for digestion. So depending on what system we're looking at. And then correcting structural integrity could be things like therapeutic exercise or chiropractic or osteopathic. If someone has like an impinged nerve and it's causing arm pain, we want to correct that structural integrity. Sometimes we prescribe natural therapeutics like Armour thyroid's an example, bioidentical hormones, so that's kind of the next level up. And then pharmaceutical intervention and surgery. So it doesn't always go in this order, but sometimes, we might have to jump there first and then kind of work backwards, or other times we want to start from the least invasive and see if we can approach it from that angle first. So let's kind of get to the core of our talk. Couple facts about heart disease. One is that it's the #1 cause of death in men and women throughout the world, but that includes the US. And really want you to look at this one actually because it's a little bit got multiple facts within. So you can see it claims more lives each year than the next 4 leading causes combined. So that's diabetes, cancer, chronic lower respiratory disease, and accidents. So this number is a bit skewed in that actually diabetics, and this is in your handout, so hopefully everything, you guys don't need to jot down too much. If there's anything missing, or I'll try to point out, you could write notes in the back. But if you look at your handout, under the risk factors, there's like a double star, and it says diabetics have 2 to 4 times the risk of developing heart disease than or stroke than the general population. So if your risk as a diabetic becomes 2 to 4 times, no wonder heart disease is the leading cause, right? So that the heart disease kind of gets the attention, but a few steps before that is if we can prevent diabetes, there's a good chance we can prevent heart disease. And actually the next talk in this library is going to be on diabetes, so we can kind of work backwards from there. So what exactly does heart disease mean? And bear with me for like the next maybe 10 minutes or so as I get a little bit more anatomic and physiological, mainly because I think when we understand what's happening in our body, we're more likely to follow along with the therapies that are recommended. So sometimes we say heart disease and don't have a visual of like what is it that we're looking for. So our cardiovascular disease is basically our heart and then the blood vessels that supply the heart and also the whole circulatory system. So conditions that we consider heart disease could be coronary artery disease, could be congestive heart failure, atherosclerosis, high blood pressure, high cholesterol, and stroke. And I'll go over quite a bit of these in detail, but just wanted to get the whole broad aspect. So if you look at basically the image, you've got your circulatory system with your veins and arteries, and then your lungs basically oxygenate and provide oxygen to the arteries, and then your heart basically pumps the blood throughout your body. So we're looking at your heart and the circulatory system making up the entire cardiovascular. So you guys pretty much know this. I don't need to define high blood pressure, but the areas that I'm really going to go in depth with is the elevated cholesterol. And I'm not going to go as in depth with diabetes and metabolic syndrome in this talk, but the next talk is going to be quite a bit of that. And I encourage anyone that you know that's got someone with diabetes or has diabetes to come in and listen to the talk. This one I'm going to go over quite a bit because atherosclerosis is basically stiffening of the arteries. If you can imagine, whenever the arteries become stiff, they're not able to dilate and contract, and that can affect blood pressure. Whenever the arteries become stiff, you can't relax the arteries to lower blood pressure. So we definitely want to make sure that the arteries aren't thickened to be able to pump sufficient blood throughout the body. So I'm going to focus a lot on this today. And then, as I mentioned, stroke is part of the vasculature of our circulatory system. So whenever there is uncontrolled blood pressure or sometimes even a rupture of, the certain vessels of our brain, we can get a stroke. So we want to prevent that. And then I'll give you some resources if you know anyone with congestive heart failure, how to address it naturally. In terms of risk factors, this is in your handout. These are all the risk factors that increase the risk of heart disease. Poor diet, we're going to go over that quite a bit. Physical inactivity, being overweight, having metabolic syndrome. Basically, metabolic syndrome is a cluster of conditions that includes changes in weight, changes in blood pressure, changes in cholesterol. There's basically 3 of the 5 set of criteria that can make someone have metabolic syndrome. And the stats are unbelievable. It's something like 70% of people may have it and not know it. So that's more of the preventative element. It's not something where you get your fasting glucose done with your doctor. The doctor says it's borderline, come back in 6 months and it's like you're a walking diabetic. So metabolic syndrome predicts the likelihood that someone could become diabetic. So it's a really good preventative awareness. Notice I put the word total next to cholesterol. If you guys get your labs done, you'll see your lipid panel. It says total cholesterol, HDL, LDL. And the total is the LDL and the HDL combined. But it kind of doesn't make sense because we want a lot of HDL and we don't want too much LDL. So looking at the total doesn't tell you how much of the good you got and how much the bad you got. And imagine you've got lots of good and brings your total up. So it's kind of a false high, right? So we don't always look at the total. We actually look at the LDL and HDL breakdown. And today I want to introduce you guys to the concept of oxidized LDL. Who's heard of that term, oxidized LDL? Okay, great. Brand new, 1%, brand new information. And there's more and more information coming out about that term. So I'm going to explain what that is.
From your email.
Oh, okay, thank you. Someone read my newsletter. So we're going to go over that. And
someone is reading your email.
Thank you. That actually leads to the next one about smoking. It's one of the risk factors for oxidized LDL. So we're going to go over that today. Heavy drinking, that's actually an independent risk factor for high blood pressure. So we'll go over that. Here's what high blood pressure means, anything over 140 over 90. Family history, age, sometimes I say don't let age defy, your risk factors because there's so much you have control over. And then last but not least, this word, which we'll talk about how that affects us. So that's in your handout. And in terms of symptoms, we sometimes hear the classic, chest pain, pain radiating down our arms, sometimes difficulty breathing, shortness of breath. They're not always that easy or apparent. Sometimes, and most of the time, there are no symptoms. And it's usually at the doctor's appointment that you notice there might be something going on. So whether the doctor measures blood pressure and says it's elevated, or they might notice a heart sound being off, or if they suspect that, they might do a stress EKG or just a regular EKG, and then they might do some labs. And if there are labs we want to do for screening, there are tests that I'd like you guys to do, especially if you want to be really thorough, and that's in your handout under screening tests. So I'm going to go over some of the ones that commonly don't get addressed by conventional doctors. A lot of times they just do a lipid panel. You get your total cholesterol, HDL, LDL, and we kind of look at the numbers and off you go. We don't break it down and go really in depth in terms of preventative markers. So you see that word oxidized LDL again. I'm going to talk about why it's important to get that done rather than just your lipid panel. Always ask your doctor for this. Have you guys heard of C-reactive protein? It's a marker for inflammation. A lot of times inflammation predicts a health problem. So you might have heard of pharyngitis, sore throat. It ends with the word itis, I-T-I-S. That's the Latin word for inflammation. Or arthritis, that's another one, tonsillitis. Anything with itis means inflammation. And highly sensitive CRP is a marker that you can use to assess how much inflammation may be going on in your body. So I always encourage people to get that done. There are ranges that the lab will have. The closer it is to 0, the better. And a lot of my patients, have like low numbers, like 0.1, 0.5, below 1. And I'm always like, put it on your fridge and show it off, because it really says a lot about how inflammation is low in their body. And if it's elevated, then we want to dig and say, well, where in the body is inflammation going on? And sometimes it's a good indicator of atherosclerosis or plaques in the arteries. And we'll talk about how we can reverse that. Homocysteine is another marker. Basically, it's a metabolic byproduct that requires B vitamins to prevent it from building up. So I'm going to talk about how B vitamins can lower homocysteine. But for now, just ask your doctor to get that done for you. Ferritin's another one. A lot of women get that done if they're iron deficient, but we don't realize that too much iron is toxic. So some people may have elevated ferritin levels, and that is a marker for inflammation. So definitely ask your doctor about that. Fibrinogen's a marker for clotting. So, we always talk about baby aspirin to prevent clotting. Well, do we even need to take it? Well, if there's high fibrinogen, the body's more likely to be in a clotting state. So we could even encourage people to eat more garlic or onions or ginkgo if they're not taking a blood thinner, things that could thin the blood. So that's a good marker. Lipoprotein A is another good marker for heart disease. And then there's some specialty tests. This one, if you talk to your doctor about, they'll probably know what it is. It's called VAP. They'll look at the breakdown of some of these cholesterol markers. And then there are 2 specialty labs, SpectraCell and Doctors Data, where it's called a comprehensive cardiovascular panel, and they'll do the whole panel, like everything you look at. So it's much easier. Part of the comprehensive is actually a fasting insulin and a hemoglobin A1C. And it amazes me how many people don't get their insulin levels checked. I mean, even diabetics I've seen without insulin levels getting checked. And that's a really big marker, because if your insulin levels are high, it may be a sign that you're taking too much sugar. And people think, oh, I don't eat sugar, but it could be sneaking in a way of like eating 2 bananas a day or having orange juice or things that we don't think of as sugar, but it's sneaking into our diet. So insulin's a good marker for how much is your pancreas under pressure. How much sugar is it getting? Hemoglobin A1C is another one. I think more of you may be familiar with that one. It's a 3-month average of your blood sugars, but I do find that the insulin is a better marker in a sense that your, you can tell how well your pancreas is working. Ask your doctor for vitamin D, thyroid panels, uric acid, and this is a marker for kidney function. So all of this is in your handouts, and it's kind of broken down in terms of why it's necessary to do it. So high blood pressure is definitely one area where when we say first do no harm, we want to make sure that it's not, if you can imagine anything with high pressure, like even if water's got high pressure, it can break rocks, right? So we don't want something to damage your arteries. And our goal is always 130 or less. I've noticed the standard has been changed to 140/90, which gives you more of a cushion. But if you want to be more preventative, that's kind of our goal. There are certain risk factors that can elevate blood pressure. So as I mentioned, alcohol, more than 3 alcoholic drinks per day is an independent risk factor for high blood pressure. Notice I wrote high sodium diet and not high salt diet. A lot of times we eat processed sodium and not natural salt. Sea salt has other minerals like magnesium and potassium and calcium that balances the fluid distribution, and it doesn't make you kind of retain water. So plain sodium can be a problem, and I think when we eat processed foods, we get so like thousands of milligrams more than we're supposed to, and that's why you see sodium becoming a problem with blood pressure. But if you're cooking at home, you kind of have control over how much sodium you put in your diet. It's only when you eat out that you just have no idea. So sodium can play a role, but I wouldn't be as afraid of it if you're using sea salt at home. It's just when you eat out or eat processed, you're going to get a lot more than you realize. Dehydration, and that's actually a big deal in nursing homes. Sometimes they have a hard time maintaining people's blood pressure. One day it's high, one day it's low, and they can't figure out what dose to gauge the person at. And a lot of times it's because they're dehydrated. And so the body's trying to regulate water, but all along the blood pressure is being affected. So don't forget to drink water. And I wrote the amount of how much your body needs. This was a really good study. There was a 12-week program where people did Tai Chi, and it reported to be just as effective as aerobic exercise in decreasing blood pressure. So you don't necessarily need to go on the treadmill and run. I think that's great for heart health as well, but anything that helps movement and helps lower stress can play a role in reducing blood pressure. I put food allergies here. Sometimes I see it that people may have certain sensitivities to certain foods and it could affect their blood pressure. Obviously, we know that if we have extra weight, that can affect blood pressure. And a lot of times losing 10% of your weight can normalize blood pressure. So that's a really easy rule of thumb to go after. Sometimes heavy metal toxicity can do it. There are certain labs that can measure your burden of heavy metals. It's not just a simple blood test where you check your levels of mercury or cadmium. Those are the top two that have been shown to elevate blood pressure. By the way, this is really high in cigarette smoke, so smoking is a risk factor for high blood pressure as well. There are specialty labs you could do to measure heavy metal burden, so to find out if you have that. But consumption of too much fish or a lot of heavy metal, a lot of mercury fillings, and if someone has blood pressure they can't explain, you might want to look into, well, could this be a part of the cause? Again, it's always about treat the cause. This may not be the problem for everybody, but it's always good to look at, well, what's the body lacking, or what is it getting in excess, and how can we remove that? So back to address the cause, and then again, if it's not controlled naturally, we might need a medication because the risks are worse than potential problems with the medication. Okay, so how are we doing on time? Okay, so there's going to be time for questions, but I just want to get to the core of the presentation. So just the word on cholesterol, and you notice, okay, what's a truck doing here? So if you look at LDL and HDL and you break down what the word is, it stands for lipoprotein particles. So these are basically little carriers that take cholesterol and they move it around different parts of the body. So LDL can take the cholesterol and potentially, and I emphasize that word, could potentially dump it in the arteries and cause problems with atherosclerosis and plaque formation in the arteries. But what the HDL does a lot of times is it dumps it out of the body. So that's why they say that we want you to have more HDL because it takes the good cholesterol and dumps it out, whereas the LDL has the potential to cause damage with the arteries. So you can see by itself, cholesterol is not the big deal. It's where cholesterol goes that's the big deal. So, and just to kind of shine a different light on cholesterol, we need cholesterol to make hormones. So if you look at the top line, everything in this picture all starts with cholesterol. So you need it to make progesterone. Oh, thank you. Does that work? Might be too light. Can you guys see that? It's okay. Okay, thank you. I'll just read it out. Thank you. So you need it to make progesterone. You may have heard of that word. Have you heard of the word cortisol? We sometimes think of it as a stress hormone. It might be if there's stress, but some of it is required for your body to cope and adapt to your environment. So you need it to make that. There's DHEA. That's the hormone that we call the fountain of youth hormone. So sometimes we want to measure that, but a lot of times what's interesting is when people take cholesterol-lowering medications, they feel like their vitality's gone down. Sometimes they say they feel depressed, and it's because these hormones, like if you look at DHEA, it's the precursor to testosterone and estrogen. So if you block the very basis of these hormones, people are not going to feel as vital. So I usually say that because, there are only a few percentage of the population, if they've had a history of heart attacks or they have a very serious family history of heart disease, where lowering cholesterol could prevent heart disease. But more and more information is coming out that cholesterol does not necessarily equal heart disease. And so I wanted to shine a different light on cholesterol is not such a bad thing. And just kind of another diagram. I love this diagram. I don't know where I got it, but basically, it just shows that, first of all, only a quarter of cholesterol comes from your diet. So if you're telling your doctor, I swear I'm really good with my diet, but my cholesterol's high, it's only a quarter. The rest of it, your liver makes. Your liver makes cholesterol. So it's not so much that it's a problem. It's a matter of how much HDL do you have versus LDL. Because if you look at, instead of trucks, there's this guy carrying the cholesterol. The LDL could carry the cholesterol and potentially dump it in the arteries, whereas the HDL could dump it out of the body. Okay, there's that word that I promised to talk about.
The liver produces LDL and HDL both?
Yes, yeah. Well, the liver produces cholesterol, and then your body has these molecules, these protein molecules, that takes cholesterol to different parts of your body. So
how does LDL ratio, who decides?
It's the body, yeah. So you could actually change those numbers. So exercise increases your body's levels of HDL. So what happens is when you do cardiovascular exercise, your cells become oxygenated, and that changes the ratio of the HDL. Yeah, so that's why lifestyle is so powerful. And then we'll talk about how to lower HDL. That's more lifestyle, diet.
So you're saying liver causes more than the food?
Yeah, 3/4 to a quarter.
We can go out and eat hamburgers now?
Well, there's that quarter, right? And so actually hold that thought, because the question is, where did the burger come from? How did the burger get made? Because that feeds into the oxidized LDL. So if the hamburger is fatty and you fry it in high temperature, you've oxidized that food. That's why fast food's a problem. Same thing with like fries, like when you, I won't mention any fast foods, we're being recorded here. But a lot of the fast foods actually don't replace their oil. They keep the same oil for days, maybe even a week. And that oil just gets reheated over and over and over, and it could become rancid. And the rancidity causes what we call free radicals. So these are chemical molecules that when you ingest it, they're split. So our body likes to have molecules bound together. So you hear like H2O, water, right? 2 molecules of hydrogen with water. So whenever you have high temperature, it splits the molecule and you ingest the free radical. And it's a very unstable substance, so when you take it in, it needs to bind to something. So if you take an antioxidant, it could potentially bind to that and prevent damage. But if you don't take antioxidant, it could touch the walls of the artery. That's what starts atherosclerosis. So your diet, even though that quarter looks like not very much, it's like a time bomb. It's like waiting for it to stick to something and cause damage. So I wouldn't say, oh, I'll just go and have a burger. I mean, you could make your own burger or go somewhere where the burger's lean and is cooked in a low temperature. But anything fast food, fried food, high temperature cooking, if you're in a very polluted environment, that's also chemicals, smoking. There are a lot of risk factors for oxidizing the LDL. So basically what oxidized LDL means is that the LDL is now bound to the free radical, and it could potentially cause plaque. So you can see a normal artery's got like a nice opening. You can have blood flowing across it, right? And then initially there's like a fatty streak. You can see that upper corner around like 2 to 4 o'clock is kind of fatty streak. More and more builds up and it becomes really thick, and then it can actually become ruptured. And the LDL contributes to that entire process. And that's where people say, well, I have chest pains, because suddenly the flow of the arteries has become restricted and there's not enough oxygen to the chest, or it might cause rupture of the brain or not enough flow to the brain. People might get heart attacks, or they might get fluid in their legs because of not enough circulation, or heart attacks that can cause death. So this is really what initiates the process. So you could see here the summary is that the LDL is susceptible to oxygenation and, to oxidation, which is actually oxidation, it's the same word. And then once it gets involved, it can progress to atherosclerosis, specifically coronary artery disease, which is the main artery of the heart. And then if you take antioxidants, it can actually protect you against the oxidation of the LDL molecule. The nice thing is we can measure the LDL, the oxidized LDL, and if people have elevated levels, we just load them up with tons of vegetables and maybe even nutrients that like vitamin C, vitamin A, CoQ10, alpha lipoic acid, things that are very high in antioxidants. Do it for 3 months, recheck the oxidized LDL. If it's gone down, you're on the right track. So
in the lab, when they measure, I don't know, there is a formula, I talked to the doctor. So you have to ask them that you measure my oxidized LDL?
Yeah.
Whatever they measure in the lab is oxidized? Or
it's not, it's just LDL. So there are only a few labs that I know of that do it. So you'd have to tell your doctor, can you order it for me through such and such lab? Yeah, but they are available. It's a simple blood test like other tests. It's very new. Yeah, I've only known about it for a year. Yeah. So these are some factors that could cause oxidized LDL. So we talked about cigarette smoke, fast foods, hydrogenated fats, fried foods cooked at high temperatures, pollution, radiation, and pesticides. I hope that's in your handout.
There goes my strawberries. Pesticides.
Pesticides? You just get organic. You're good to go. Okay, so how can you optimize your cholesterol levels? The other area that initiates atherosclerosis is inflammation. So whenever there's plaque formation caused by this oxidized LDL, your immune system actually is the first to go and says, whoa, I see damage, I'm going to try to repair it. And that's when you see inflammation. So when I mentioned that highly sensitive CRP test, if it's elevated, it's because your immune system's trying to help inflammation go down, and it's a sign of inflammation. So that's why I kind of put that fire extinguisher. We want to lower inflammation, and we want to do things to prevent it. So first of all, I think in our society, we're so focused on what do I take. We're always wanting to buy supplements. If it's not a drug, we want a supplement. Focus on what am I doing in excess? What is in my body healing itself? And remove that. That goes so much further than packing more stuff in your body. So if your diet is full of sugar and grains, if your diet's full of hydrogenated and margarine shortening, stay away. If you're being exposed to pollutions, if you're a smoker, definitely quit. Lack of physical activity, unmanaged stress, remove this and your body goes a long way. The other part I put is about eggs. Their eggs get a lot of bad reputation. The problem with eggs is only when you fry it in really, really high temperature in open air. So if you're scrambling your eggs within 30 seconds or really, really quick, that could oxidize the cholesterol that's in eggs. But if you cook it in low temperature, or better yet, boil it, in hard-boiled eggs, the shell is protecting it from oxidation. And there's actually evidence that it could lower your cholesterol because it's rich in biotin and B vitamins and can do the opposite. So eggs get a bad reputation only because of the way they're cooked. Otherwise, I would not be afraid of eggs. Okay, so here's this picture again, normal artery, atherosclerosis plaques. And what really makes the picture worse is the inflammation on top of the oxidized LDL. So there's two components that kind of initiate atherosclerosis. Yes, so carotid artery is the main artery that supplies the heart. Atherosclerosis is plaque formation anywhere in the circulatory system. So carotid artery is just one of the arteries. Yeah, but it's the main one that supplies the heart, and it could lead to heart attack. And then sometimes they do the artery along the neck because they want to see, well, if that's the one supplying the brain and there's calcifications, we want to make sure that we reverse that.
Both sides or one side?
Both sides, but yeah. But sometimes one side may be more occluded than the other, so they usually do both, yeah. Okay, so that's the term. So arteriosclerosis is basically anything that causes the walls of the arteries to become stiff, and atherosclerosis is one of the causes. So the word athero means fatty deposit, and that's why you hear all these terms. Arteriosclerosis, athero. It's basically all about the arteries, but the mechanism's different. And so basically what we want to prevent is atherosclerosis, and you can see the problem is that 1 in 3 people dies from complications of atherosclerosis, and that's really what we want to go back and look at. So here's the question you had: arteries that supply the heart, the coronary arteries. You may experience chest pain or a heart attack. Okay, so just a few studies on atherosclerosis, just to show that it's reversible. Again, I wouldn't be standing up here if the message wasn't hopeful. Your body heals itself. So even if there are occlusions in the artery, we can reverse it. And Dr. Dean Ornish, who's heard of Dr. Ornish? Great, oh, I love all these hands. So Dr. Ornish has a lot of great studies about that. And one of them was looking at different components. So you can see obesity, type A behavior, and that was defined as time-conscious, impatient, and aggressive. Stress, sedentary lifestyles are all associated with increased risk of atherosclerosis. Smoking is directly linked to atherosclerosis and heart disease, and low levels of social support, especially combined with high levels of outwardly expressed anger, has also been associated with progression of coronary atherosclerosis. So it's like you look at this and you're like, where is cholesterol in this? I don't see that word. We just have so much focus on that word, and we don't realize our lifestyle has so much more of a role. I really love this book, Love and Survival, Dr. Ornish's book. I'm sure the library has it. I would really encourage you guys to look at it. Okay, more pictures. So there's that blood clot I was talking about. So the yellow is the fatty deposit, and then your immune system tries to repair it, but unfortunately it could clot. So then you get a really fully occluded artery. And that's the coronary artery that you see right there. Okay, so we kind of talked about that. Kind of summarizing. So coronary artery disease is a leading cause of heart attacks. It's the artery that supplies the heart, and you could see the main arteries that are supplying the heart over there. Okay, so what do we do about addressing it? So is always lifestyle, the way we move, the way we eat, our thoughts, lifestyle, sleep, rest, relaxation. And then I'm going to go over supplements and common nutrients that people might want to consider. Some medications that may be necessary, and then you can see, some may even need pacemakers or bypass. It's just part of the treatment consideration, but we're going to talk about lifestyle today. Our attitudes, emotions, stress management, and I love this from Prevention. Healthy People 2010 suggests preventing and identifying atherosclerosis as early as age 20. So these young kids who are like eating all the junk in the world and say, oh, I'm young, they might want to start thinking proactive. Okay, so conventional treatments, you guys who've heard of the word statins, these are the cholesterol lowering medications. There are unfortunately some people who have side effects to them. It depletes the body of CoQ10, which is a major antioxidant that the muscles and the heart needs to produce energy. So when the body gets deficient, people notice muscle aches. So it's sometimes even as bad as the muscle melts away. We call that rhabdomyolysis. So if you know anyone who's on a statin and they have that side effect, I would encourage them to take CoQ10. They could even consider a natural approach to rather than statins, but if they want to stay on it, a CoQ10 supplement might prevent that side effect. You can see another conventional aspect with hypertension medications, again, the benefit to risk analysis. If you know anyone on metformin, if they're diabetic, let them know that their body may get depleted on B12. So have their B12 levels checked, and if anything, supplement with B12. And then I just mentioned surgery because sometimes it may be necessary. There's a really great Dean Ornish study about that, so I'll talk about it in a second. Or now, okay. So Dr. Ornish basically had patients that were on the waiting list to having surgery, a coronary bypass. And while they were waiting, he put them on this regimen, on a whole foods plant-based diet, smoking cessation, regular exercise, stress management, including yoga and meditation, and psychosocial support. And what he found was that not only this regimen stops the progression of coronary artery disease, but it could actually reverse it. And when they went to measure they looked at the stents, and they looked at the thickening of the occlusions of the arteries, it actually gotten less. So the power of the things you have in your hands, it's incredible. So again, the foundation, as I wrote down, the way we eat, the way we exercise, sleep, rest, relaxation, and following our passion. With regards to diet, I'm going to talk a lot more about this at the diabetes talk, the whole low glycemic, because that really leads into preventing diabetes. But I think anybody needs to follow this. Low glycemic foods, mainly vegetarians with some lean meat or fish. Eating 9 servings of fruits and vegetables, that seems like a lot, but you can do it. Like having a salad with lunch and dinner and having a smoothie in the morning takes care of it. I normally don't like people to eat more than 2 to 3 servings of fruit, especially if they're diabetic. We're so used to juicing. We'll have an orange juice and don't realize it's like eating 4 oranges minus the fiber. And how many of you can eat 4 oranges, right? But when you juice it, you're getting this influx of fructose, which is a little bit different than glucose, but it's still really hard on the liver and the insulin from the pancreas to try to get rid of it. So it causes a lot of problems. Garlic and onions are great. They're nature's blood thinners. If you are taking a blood thinner, don't eat too many of that. Your doctor may even say don't eat too many leafy green vegetables. But if you're not taking a blood thinner, then definitely garlic and onions are great. Lean meats, fish, high fiber.
People suggest, Dr. Oates suggests aspirin, even a small baby aspirin.
Baby aspirin.
Is it blood thinner? So if you take blood, then what about juice and other things?
So baby aspirin is not
okay?
as bad as blood thinners. It's typically if you take a baby aspirin and you eat garlic and onions, and if it's too much, you start to show signs of bruising. And that's when you know that maybe you've got to back up. And your doctor could actually measure your clotting time and see whether it's too much. So it's not so much I worry about that. It's the actual blood thinners. With water, that should be your liquid of choice, not soda. And a good rule, this is in your handouts, is to take your weight in pounds divided by, either 3 or a third or half of your weight. That's how many ounces of water you need every day. And then definitely make sure you eat fiber so that whatever your body is getting through diet with cholesterol, fiber can actually bind to it and get rid of it. So that's a great way to control blood pressure. This is fantastic for lowering blood pressure. There's a research study, 2 to 3 stalks of celery lowers blood pressure by 5 millimeters of mercury, and that might be enough for some people to stop them from taking a medication. So it might even buy you time till you find other causes. Maybe you have some weight to lose, or you're trying to quit smoking, or you're trying to wean off alcohol, like whatever you're trying to find the cause, this can actually support your body in the process of doing that. Again, lifestyle, things to limit fried food, fast foods, alcohol, quitting soda, quitting smoking, no saturated fats. Make sure you eat lean animal protein. And that's probably the problem with eating out. You just don't know how lean it is. I think a lot of restaurants, the fattier, the more sugar, the more salt they add, the tastier it might be, and people just go back for more and they overeat. So eating out can sometimes, you got to be picky where you go. Limiting fried foods, limiting simple carbohydrates, sugars, and definitely fructose. We overlook that fructose in the form of high fructose corn syrup or just plain old fruit sugar can be a problem. So definitely limit that. If you're not sure what glycemic index is, this is a good resource, glycemicindex.com. A lot of your whole foods are low glycemic. So if you look at this chart, not this one. The low glycemic foods could be things like apples, berries, barley, grapefruit, your legumes like lentils and beans, nuts, oatmeal. This is kind of questionable actually. Yogurt can be a lot of sugar, but it's better than sweetened yogurt, which is unbelievable amount of sugar. And then the high glycemic foods are all the processed packaged stuff. So candy, cookies, juice, potatoes are actually high, white breads, white rice. You definitely want to limit those.
Question on that.
Yeah.
Carrot and celery combined, is that considered, what's your take on it?
So carrot gets mixed reviews, but carrots are high glycemic index, but they're low glycemic load. So the difference between the two is the load is the serving size. So if you eat one serving of carrots, which is like half a cup, it's a low glycemic food. But if you're gonna juice carrots, you're gonna get a huge load of it, right? So it's the amount in that case that matters. If you mix celery and carrots, it's even better because celery is such a low glycemic that when you combine something like that, it slows down the release of sugar. A lot of these foods that are low by nature have a lot of either fiber or good fats or protein. Those three things slow the release of sugar, but plain sugar or anything processed with the fiber taken out is gonna go straight to your blood. So that's why these are actually a bigger problem.
So where the brown rice and the
It's
whole wheat will go?
kind of in between.
Somewhere.
Yeah, somewhere. It's more of a moderate. Yeah,
Thank you.
sure, great question. So look at the top heading here. High blood sugar creates harmful changes in LDL, HDL, triglycerides, increases clotting, increases blood pressure, inflammation, decreases blood flow, and atherosclerosis. Isn't this the whole core of heart disease? Look where it starts, blood sugar. And that's why the next talk is going to be all about blood sugar and that's why diabetics have 2 to 4 times the risk of heart disease. It's all about sugar. And we're not really getting it right now in terms of the medical area. We're just so focused on cholesterol, but that's really not the focus where it should be, it's sugar. Okay, so here's the metabolic syndrome I was talking about. So 3 of any of these makes people be considered having metabolic syndrome. So in men, a waist size greater than 40 inches, and women greater than 34. Any changes in their lipids with HDL or triglycerides. Notice LDL is not on there. So again, we focus so much on LDL, but we don't realize there are other risk factors. So either of these, the way to basically address HDL is exercise. So HDL can go up with exercise, the body's weight can change, the waist size can change, triglycerides can go down. I think the best approach to metabolic syndrome is exercise and obviously eating a low glycemic meal. But a lot of these, I just keep thinking diet, exercise, like how powerful our lifestyle is. But a lot of people hit at least three of these. They either have problems with their cholesterol or they're overweight, or they might have borderline blood sugar or their inflammatory marker may be high. Just 3 of these makes you considered metabolic syndrome, which is a major risk factor for diabetes. So this is why I really want to hit home how to prevent metabolic syndrome so that we don't see this huge diabetes epidemic that we're seeing. This is a picture of what a body composition is about. Unfortunately, our scale is not necessarily a good indicator of how our body should be in terms of composition. So these 2 ladies could have the same weight, but when you break down their body composition, she could have a greater muscle mass than she can. And this is sometimes what we call skinny fat people, where their weight is normal, but they have a lot higher body fat than someone else who may be the same weight, but they're more lean. So it's better to go beyond your weight and look at your body composition. And sometimes I have people who lose, don't lose any weight, and then we check their body composition, and they've actually lost 5 pounds of fat, and they've gained 5 pounds of muscle. So on the scale, it doesn't look like anything. They're all discouraged, but then they're like, well, all these changes that they made paid off. It's just doesn't look that way on the number scale. If you're not sure how much your weight should be. This is a good rough estimate. The BMI is not always an indicator, good indicator, especially if someone's really muscular, but it gives you a good idea. So a healthy BMI is somewhere between 19 and 24. So for example, if someone's 5'6", and they weigh 124 pounds, they're in the healthy BMI range of 20. But if they weigh 191 pounds, they're considered obese at a BMI of 30. So you can actually track your height and kind of look at this range and say, okay, my body weight should be between such and such range. And it's kind of a good estimate. And then I think that body composition analysis can go a little bit more in depth. Why is BMI a good estimate? Well, we kind of have an idea of what people's general body mass, of their muscle mass is. So, like I said, unless they're super muscular, it's still a good indicator. And you can see if you look at diabetes risk, the higher their BMI is, the greater the risk of diabetes. So that's why it's still good to look at that. Same thing with high blood pressure. The higher the BMI, the higher the risk. And then same thing with coronary heart disease. You can see as the BMI goes up, so does the risk. And I love this chart. So kind of what a portion size was for a burger in 57. Well, this is 97, so imagine now. A cookie then, a cookie now, kind of soda sizes, definitely in the theater you see that. And then I like this part, the consumer in 97 with the salad, asking if it's a non-fat dressing.
This is grandmama's thing. In 1957, grandmama used to give hamburger and a cookie. She needed a small one.
Yep.
Kids, now you go outside and buy,
Yep.
They make it more free.
They buy and they don't even have
Bigger
ideas
and
of,
bigger, buy one, get one free.
yeah, kind of like even that, exactly.
And 100 years ago, the plate size was quarter plate.
Exactly. I think our proportions have kind of gone out the door. It's like even the cars are bigger, everything's bigger, so it's kind of good to get back on track. I have a disclaimer on here about nutritional supplements. I don't talk about supplements as much in these talks because I want you guys to be more lifestyle oriented. That said, there are a lot of great supplements that are helpful. I just want it to be more specific for you. So I'm going to point a little bit to some things to consider. I always want you guys to talk to your doctor about it because you never know what interactions they may have or what the right dose they may be for you. But I'll just give you some general guidelines. The ones we'll talk about is omega-3 fatty acids, what antioxidant nutrients are, B vitamins, so B3, B5, B6, B12. I won't talk too much about these two, but red rice is actually what statin medications are made of. It's more the natural form. So some people get the same benefit being on a red yeast rice than they do with statins, minus the potential side effects. That said, I still recommend people to take CoQ10 with red yeast rice. I rarely put people on red yeast rice because the other natural approaches work so great, but this is an option. Googles are actually an Ayurvedic herb that can lower LDL, elevate HDL, and kind of improve the profile of cholesterol. So that's another one that I've used in the past. Again, it's an herb, but a lot of times we could just do it through lifestyle. This may not be in your handout, so if you want to jot it down, anything you like, just want to point that out. Okay, so everyone's heard of omega-3s. You've seen the breakdowns of EPA and DHA. EPA is the anti-inflammatory portion. The DHA is more the component of the fatty acid that helps in terms of cognitive function. So you might see like the children's fish oil has more of the DHA concentrated because kids their brain's developing and growing and they want more DHA. Whereas as adults, we want to lower inflammation. So EPA is the bigger component. So why is that even a big deal? Well, every single cell of your body is made up of fatty acids. So the membrane, basically whatever fat you give it, it becomes that. So if you give it a really good quality omega-3, the membrane is more sensitive to communicating with outside of itself. So insulin, which is a hormone, can better communicate in terms of transporting sugar into the cell. So even diabetics can benefit from an omega-3 fatty acid, either supplement or foods that are rich in it. I'll talk about foods that have high amounts. So we don't just always think, okay, lower sugar, but how can we make the cells really sensitive so that it can metabolize the sugar? So you can see that's why it says omega-3 fatty acids improve the effect of insulin. What else do? They reduce inflammation, they thin the blood, they lower triglycerides, and they reduce other risk factors for disease because of inflammation. So,
If you're taking a blood thinner,
yeah.
should you not take omega-3?
Yeah, exactly. So that's another. Blood thinners unfortunately make it really hard to take anything. So like I said, your doctor will even look at vitamin K and say, okay, don't take too many leafy green vegetables. They're really difficult drug to work with. So that's why even the disclaimers there, talk to your doctor.
Vitamin K, is that kale?
Kale is one of them. Anything dark leafy green is rich in vitamin K.
So you shouldn't combine that with blood thinners?
You want to be careful. So most likely when patients are on blood thinners, they're going to have their INR, their clotting factors, monitored regularly. So your doctor will say, well, I'm noticing, a potential for, for blood being too thin, so back off on, vitamin K. So your doctor will be the better monitor of like what you need to tweak. Yeah.
So what are the blood thinner medicines?
Like Plaquenil is one of them.
I'm taking Plavix.
Plavix, Plaquenil.
Aspirin is a blood thinner.
Aspirin is a blood thinner. We're talking more like the actual, there are different mechanisms. The Plaquenil and the blood thinners have a different mechanism where it interacts more greatly with other anti-inflammatories, whereas aspirin's kind of on the edge. Your doctor's not going to be on you so much about vegetables. And I have patients who take aspirin and still eat fish and take fish oil, flax oil, and no problems. It's just you want to still monitor them. Yeah.
How about omega-6 and omega-9? Because right
Yeah.
now you hear more and more, I'm confused.
Yeah.
Omega-3 now I understand, but 6 and 9.
Yeah.
Do we really need it, or it's just
We do need it, yeah. There's so much focus on omega-3 that we forget omega-6 and omega-9 are also essential. This is why, so what's in omega-6 and 9? It's things like walnuts, meat, red meat has more omega-6. It's the ratio you want to look at. So in our culture, because we don't eat enough of the omega-3s, we've got a higher ratio of omega-6 to 3, and it could put your body in an inflammatory-like state. Whereas if you balance the ratio of the 3 to 6, you're in more of a kind of lower inflammatory state.
So the over-counter vitamin, they have omega-3 or omega-6 or 9, whatever. Do they adjust the ratio already or whatever? Or they dump everything in?
When it's 3, 6, and 9, they usually add multiple oils. They'll have like borage oil or evening primrose oil, flax oil. Different oils have different compositions of the 3, 6, and 9. So it's especially good in vegetarians because it's not like they're over consuming meats and they're getting too much omega-6. So they might actually over favor omega-3s. So it's better to have all of that. Yeah, so you'll see actually products in the market that acknowledge that omega-3s are not everything. Yeah. It's a great question. So part of the reason I emphasize the 3s is that a lot of people indeed have elevated inflammation, and omega-3s do lower inflammation. That's why there's more focus on that. So these are some of the foods. We always think fish. Fish isn't the only thing that has omega-3. So my favorite two products in terms of like supplements that you could take is either ground flax seeds or flax oil. But you could always eat avocados with your salads. You can eat walnuts. Organic butter actually has omega-3s, chia seeds, pumpkin seeds, sunflower, coconut oil, olive oil. This is why you see a lot of studies on the Mediterranean diet preventing heart disease, is because olive oil is so rich in lowering inflammation. And then egg, cheese, and milk are low only if the animal is grass-fed, because they're getting their omega-3s from nature. And then, sorry, one second. The fish, I like overlooked fish. Sardines, salmon, and then you could take fish oil or krill oil. Go ahead.
I think I read somewhere about omega-3s and statins don't get along. Is that true? Or
Not that I know of. No, you could combine them. Yeah, yeah.
Grapefruit is one thing.
Yeah.
Grapefruit.
Yes.
Grapefruit
Statins.
is
Yes.
completely prohibited with the statins.
Exactly. So the reason being is that grapefruit can inhibit part of the detox pathway of your liver. And if the product isn't broken down, more of it is available in your blood. So it can actually change the dosage of the medication. You could raise it higher. So there's certain medications that act on this pathway called the cytochrome P450. And that's the one that grapefruit interferes with. So you don't want to mix drugs that act on that pathway. Yeah, so that's probably the comment you might have read.
So why don't oranges have the same effect?
Great question. It's just grapefruit. Yeah, they've looked. And what? Yes, that's in that.
So grapefruit I could avoid, but I had to look it up in public.
Yes.
And Seville oranges.
Really? I did not know that.
There's
Okay.
Anyway, not that you don't usually eat them.
Probably this is not as common. Okay, thank you for sharing that. Yeah, so even lemons are okay.
But my doctor
Yeah.
said I could eat grapefruit if I ate the same amount every day, which I could not promise to do, right? Because it becomes part of the
Stable.
dosage.
Exactly. Yeah, yeah. So it's only when you eat it once in a while because one day the dose is high, another day, so it's even worse with blood pressure. But maybe cholesterol is not as big of a deal, I would argue. But there's certain medications where you gotta have a tight control.
So
Yeah.
pomelos are okay?
They're not.
Or
No, they're like.
the same thing.
Mhm. Yeah. Okay, so antioxidants, again, why do we take them? Because we want to lower the oxidized LDL. So it could be things like beta carotene, which is similar to vitamin A. It's actually the less toxic form of vitamin A. Selenium's a great one. If you type selenium, you'll see a lot of great studies on cholesterol and also thyroid support. Vitamin C, vitamin E. Alpha-lipoic acid is actually the standard of care nutrient in Europe for diabetic neuropathy. So if you know anyone who's diabetic and they're having tingling or lack of sensation in their feet, recommend alpha-lipoic acid. CoQ10, also another great one, as I mentioned, it provides fuel to the heart. It's also great for fibromyalgia pain because it kind of energizes the cells. Mm-hmm.
So would alpha-lipoic acid also help people who are not diabetic that have neuropathy?
Yes, yeah, it can. Mm-hmm. Yeah. It's basically going to the extremities to protect the nerves from becoming damaged. Yeah. Mm-hmm. That's a good question.
Coating some sort of?
It's protecting because oxidation is basically kind of like rusting. You know, it's exactly what it is. So if alpha-lipoic acid, for some reason, it has an affinity to nerves. So if you prevent nerve damage, then, you know, you won't have the tingling and the loss of sensation. Mm-hmm.
You write there diabetic neuropathy. Is that diabetic? What's with the word diabetic?
So there are different kinds of neuropathies. Neuropathy is basically pathology of the nerves. The most common neuropathy is due to diabetes. So I just pointed that out.
I got it from taking too much medicine. Antibiotics.
That,
was one of the side effects.
yeah, and have you tried, I mean, it's a hit or miss. I'm not sure whether ALA can help. It might be, have you had your heavy metals checked to see whether you might have like an overload of either certain chemicals or certain heavy metals? It might be that. So perhaps.
They said this is one of the side effects of taking a lot of antibiotics because I got heavy infection, so I had to take it for.
Yeah, I would look at tests that do like chemical burden. There's certain urine tests you can do to see whether there's too many chemicals kind of overburdening your body. And if we remove that, it might kind of regenerate the nerves. But again, it's about the mechanism. So if there's something that's causing strict damage at the point, we can reverse it. But if it's a chemical overload, we want to remove that. It's mechanistic. Yeah. Okay, you guys have heard of that word, resveratrol? Yeah, Dr. Oz did a great job promoting that. And I think I saw so many products in the market after you talked about it. Like companies were like making this stuff by the batches. It was really funny. So this buzzword is actually very similar to this other word, flavonoid. You may have heard of that word. So flavonoids are these rich molecules that are in the outer part of the skin part of fruits like grapes, berries, and obviously wine is made from berries, so berries from grapes. So that's why you see the word French paradox is actually that the flavonoids you get from red wine, which is a part of the resveratrol, is providing support to the arteries. So what do these do? They protect the heart, but the biggest thing is that they strengthen the vessels so that it doesn't become susceptible to plaque formation. And they're basically an antioxidant to the circulatory system. They prevent clot formation, and they're actually protective. They're like detox, hepatoprotective. I've seen anti-aging properties, again, because they're preserving the cells, and also anti-inflammatory. So other foods that contain it are onions. So either onions, berries, or grapes are really rich in this.
So they will protect the cholesterol also? You talked about oxidized cholesterol, so will they affect the cholesterol and it goes, if I eat these, my cholesterol will get antioxidant? It will not be
They
oxidized?
prevent the cholesterol from becoming oxidized. So it doesn't necessarily lower cholesterol, but it doesn't make the cholesterol harmful to your cells.
So if I want to make my cholesterol good, so how this vegetable?
This kind of puts your
Oxidation is
cholesterol,
bad.
yeah.
Am I?
Yeah, exactly. So it acts as an antioxidant.
Oh, I see.
So even if you have cholesterol, it's not a bad cholesterol where it could cause damage to your arteries. That plus there's less inflammation, and then your arteries are very strong, right? If you have a strong artery, it's kind of like a balloon bouncing against the wall. It's not going to cause damage. It's just going to wash away. Yeah.
I'm confused. Thank you.
Yeah, because the red wine there, let me think about one thing. Red wine have a good thing there, but have alcohol also.
Yeah.
And from the beginning to now, I don't hear the alcohol.
Yeah.
The role play in the heart health.
Yeah.
So can you comment on the alcohol?
Yeah, I mean,
too much is not good, but I mean, just say in moderate amount or whatever is helpful or whatever.
yeah, that's the tricky part about wine and alcoholic beverages, because we know alcohol is toxic to the liver, but it's the breakdown of it, the flavonoid aspect that we're talking about having benefits. This is why you even hear dark chocolate is good for you, because it's got flavonoids, but there's also sugar in the dark chocolate. So it's just kind of the ratio. You don't hear vodka, right? Because it's strictly alcohol. So it's the component of what makes it what it is. But if it's strictly alcohol, then yes, it's toxic to the liver. So it's just a little bit of a confound there, but that's why the word paradox is there, right? The French paradox, yeah. But I think honestly, there's also a spiritual component, and also like a relaxation. I mean, if how are we doing? Okay, no, we're good. So if there is, if you're in a group, again with Dean Ornish, we were about support, right? You're with a group of people and you're relaxed and you're having a great time. That's better for you than maybe a minute amount of alcohol. I think there's kind of that psychosocial aspect to look at as well. This term again, homocysteine. So if you guys haven't had it checked, it's a very simple blood test that you could do along with your lipid profile. I think the lab range says from like 1 to 20. I could be wrong, but a lot of times the optimum is less than 10. So if you see like 11 or 12 and the lab doesn't bold it, know that it's elevated. So you want it to be less than 10. And what does this mean? Well, first of all, homocysteine is an intermediate. So we've got these amino acids, methionine, which converts to cysteine. And it requires B6, B12, and folic acid. So if the body's lacking those, methionine doesn't convert to cysteine. Instead, it starts to leak homocysteine. So it's the one step before cysteine is homocysteine. So if we see elevated levels of that, it's a sneaky way of assessing that the person's deficient in B6, B12, and folic acid. And what I've actually seen is that it's sometimes not even about B6 or B12, it's about taking the active form of folic acid, which is the 5-methyl tetrahydrofolate. And a lot of nutrition supplement companies are picking up on that. They're using folic acid in its active form as a supplementation. So make sure, if you do have elevated homocysteine, you do supplement with B6 and B12, but the folic acid is in that form, the 5-MTHF. Go ahead.
Where do we get this in food? B16, folic, and
Leafy green vegetables.
which?
Leafy green vegetables.
Leafy? Oh, I see.
Yeah.
All leafy will have.
All the Bs. There's some, in grains, whole grains will have some of the Bs too, but the richest sources in leafy greens. This is why you see all these studies that seem random, like vegetables prevent heart disease, and you're like, how? And then you get scientific and you're like, well, my homocysteine goes down, I'm getting fiber, it's low glycemic, there's like all these benefits. But it's interesting when you look at the scientific aspect and how many nutrients are protecting your heart. The other one you see here is associated with bone health. And a good bone supplement actually should have B12, B6, and folic acid in it. So sometimes when people bring in their calcium supplement and it's just calcium or even a little bit of magnesium, I'm like, that company doesn't know what they're talking about. They're just throwing some calcium, hoping the person just says, oh, calcium, good for me, I'm going to purchase this. But a really good comprehensive bone support formula should have calcium, magnesium, boron, vitamin D, and B vitamins for the reason that homocysteine can cause damage in bone. Okay, so exercise. Notice I put the word slow and progressive. I definitely, because we know it's good for us, we don't want to just start running a marathon immediately. So just make sure it's slow, progressive if you're new to it. And there are just lists and lists of benefits of exercise, right? But from a heart disease talk, it's that it does lower LDL. It increases. It's one of the few things that HDL goes up by is exercise. So no particular diet that I know of can raise HDL, but exercise can. Diet can lower LDL, but HDL is very exercise specific. It improves blood sugar and it lowers stress by managing cortisol levels. And what's really interesting is that a lot of times we kind of fixate on aging, like how do I slow down aging? And a lot of times aging is associated with fat to muscle ratios. So as we age, our body fat increases and our muscle mass decreases, because the more lean we are, the more youthful we are, right? So exercise reverses that, kind of decreases body mass, increases our muscle mass, and that's really an anti-aging benefit that exercise can do. Stress, so we're all familiar with multitasking. I'm sorry this is kind of blurry, but what I wanted to illustrate with this is that we have two components of the nervous system, and what stress acts on is the sympathetic nervous system. So the sympathetic is basically that fight or flight, where your body's thinking, okay, I need to survive the danger. So if you look at a couple things, it says accelerates heart rate. So your heart's pounding, your lungs are open so that it can be oxygenated. And you see there, it says inhibits digestive activity. So last thing your body wants to do is digest. It's like run for your life. That's why a lot of people get indigestion or they get heartburn. A lot of chronic digestive problems like irritable bowel are due to stress-related problems because digestion's not fully doing its job. The body's too busy trying to survive. So to put the body in more a parasympathetic state, that's where exercise and relaxation techniques help. So you can see in this state, our heart rate's kind of nice and slow and rhythmic, our lungs are relaxed, digestion is more optimum, our body's just in a more relaxed state. And you always do want to have a balance of the two, right? We don't want to always be in this state, but a lot of people are in sympathetic overload, especially in Silicon Valley. So when we talk about stress, we always think it's just psychological stress. We don't think about other things that may be stressing us. Again, I'm sorry, this is blurry. Things like toxicities, chronic inflammation, high blood sugar, psychological stress, poor nutrition, physical stress such as trauma or pain, and infections all are a source of stress. So they can change your body's level of cortisol, and you could see the symptoms associated to high cortisol could be high blood sugar, high blood pressure, sleeping problems, thyroid problems, poor digestion, decreased immune function, and constipation. So there are tests that you could actually do to measure your body's level of cortisol, and if it's elevated or imbalanced, when you change your lifestyle and retest, you'd be amazed how quickly the body heals. And I think this is really the amazing, honor that I have as an ND, is that I get to see people's numbers change based on what they do, the health that is in their own hands, and how we have these objective data that can kind of acknowledge that change. So we all know these very nice words that are in the stress management category. So first of all, perception, kind of changing our outlook on what a stressor is, always helps. Making sure if we do have times that are stressful, that we just have to do them, we balance them with downtime. Again, exercise is a great way to manage stress, kind of flushing out the extra cortisol out of the body. Meditation, being kind of one and centered within. Breathing exercises, yoga, and just being out in nature. And I would probably add another one, group support, being with your loved ones. These are some sources you guys can look at. And again, Dr. Dean Ornish really stands out in terms of the kind of therapeutic aspects of group support affecting heart, kind of the last part I was talking about. So if somehow cholesterol is still a big myth to you when you're like, I want to know more about it, Dr. Steven Sinatra, who is a very well-respected cardiologist, just recently wrote a book called The Great Cholesterol Myth. You might want to take a look at that. I hope the library carries it. I know they carry the Sinatra Solution, which is a book that talks about how to use nutrients to address people with congestive heart failure or chest pain. So that could be a really helpful book. And then Dr. Ornish has more nutrition-oriented books with reversing heart disease. There's another book called Spectrum. I think it's in your handouts. And then this book, which is absolutely inspiring, Love and Survival. I would highly recommend it. And then Dr. Mimi Guarneri is a cardiologist in San Diego area, and she's very integrative oriented. So she also talks about the heart speaks, and again, more the mind-body aspect of our heart and what we can do to really take care of it. So I think,
if you were to go in order, you thought was actually because they accumulate. So which one would you go first?
More general knowledge, or is it like a particular health concern?
From this collection of titles, what would you?
Is it like, is there something specific you're looking for, or just general knowledge of heart? General. Such a good question. I would go with reversing heart disease. I think Dr. Ornish has done a great job with that. And maybe the great cholesterol myth, just because we're so stuck on cholesterol and heart disease that he starts to give like a broad overview. I think it's a good summary of this, or this talk is a good summary of the book. So I would probably focus on those.
Is that more of the psychological part of it?
Dr. Guarneri? No, there's a lot of good science in it too. I think they're all good. It just really depends what area of it you're looking at. But I think in terms of nutrition and lifestyle, Dr. Ornish has done a really great job talking about lifestyle. Okay, so that is, and then just the talk next week, so not next week, next month, is going to be all on diabetes and metabolic syndrome. So if you guys know anyone interested, let them know. It's going to be right here at the library. So I think that's it. Any questions? Or